Hi students, this is chapter 53. This is the last topic, liver transplantation. Cirrhosis, scarring of the liver, is the most common reason for liver transplants. Other common reasons are chronic hepatitis B and C, bile duct diseases, autoimmune liver disease, alcoholic liver disease, and fatty liver disease. Transplantation consideration. Patients who are not considered candidates for transplantation are those with severe cardiovascular instability with advanced cardiac disease, severe respiratory disease, metastatic tumors, inability to follow instructions regarding drug therapy and self-management. Donor livers are obtained primarily from trauma victims who have not had liver damage. The donor liver is transported to the surgery center in a solution that preserves the organ for up to 8 hours. The deceased liver is removed through an incision made in the upper abdomen. The new liver is carefully put in its place and attached to the patient blood vessels and bile duct. The procedure can take many hours to complete and requires a highly specialized team and large volumes of fluid and blood replacement. So it's not only the organ, but you have to have on the side large volumes of fluid and electrolytes and blood replacement. Living donors have also been used and are usually close family members or a spouse. This is done on a voluntary basis after carefully psychological and physiologic preparation and testing. The donor liver is resected, usually removal of one lobe, and implanted into the recipient after removal of the deceased liver. In both the donor and the recipient, the liver regenerates and grows in size to meet the demands of the body. This is the amazing fact about the liver, the only organ that is able to regenerate when the conditions are appropriate, right? And the environment is healthy. Transplantation complications. The most common complications are acute graft rejection, infection, and bleeding. The success rate for transplantation has greatly improved since the introduction many years ago of cyclosporine A, an immunosuppressant drug. Today, many other complications drugs are used. Many other anti-rejection drugs are used. Nursing safety priority alert alert. For the patient who has undergone liver transplantation, monitor for clinical signs and symptoms of rejection, which may include tachycardia, fever, pain in the right upper quadrant or flank. Decreased bile pigment and volume, and increasing jaundice. Laboratory findings include elevated serum bilirubin, raising ALT and AST levels, elevated alkaline phosphatase levels, and increased prothrombin time international normalized ratio, PTINR. If therapy is not effective, liver function rapidly deteriorates. Multisystem organ failure, including respiratory and renal involvement, develops along with diffuse coagulopathies and portal systemic encephalopathy. The only alternative for treatment is emergency retransplantation. The only treatment. Infection is another potential threat to the transplant graft and the patient's survival. Vaccinations and prophylactic antibiotics are helpful in prevention. Immunosuppressant therapy, which must be used to prevent and treat organ rejection, significantly increases the patient risk for infection because they can mask, since they are immunosuppressant. The immune system is not working 100%. In the early post-transplantation period, common infections include pneumonia, wound infections, and urinary tract infections. Opportunistic infections usually develop after the first post-operative month and include cytomegalovirus, mycobacterial infections, and parasitic infections. Um, when a patient is in the hospital for more than 20-25 days or a month, it's, it's almost impossible to be out or to avoid opportunistic infections. They are gonna come sooner or later. The less you stay at the hospital, the better. Okay. Latent infections such as tuberculosis and herpes simplex may be reactivated. So these are viruses that are dormant in the system. And with this type of procedures or complications, they are going to be reactivated. Women, Hispanic, and patients with less than a high school education are most likely to be readmitted with transplant complications, although the cause is not known. The primary healthcare provider prescribes broad spectrum antibiotics for prophylaxis during and after surgery. Um, the biliary anastomosis is susceptible to breakdown, obstruction, and infection. If leakage occurs or if the site becomes necrotic or obstructed, an abscess can form, or peritonitis, bacteremia, and cirrhosis may develop. Observe for potential complications. So it's not whatever team of nurses who is taking care of these type of patients. Usually are very skilled and very specialized nursing staff, because you have to be aware of everything, every single detail. For the patient who has had a liver transplantation, monitor for temperature frequently per hospital protocol and report elevation, increased abdominal pain, distension, and rigidity, which can be indicators of peritonitis. Give me 2 seconds. My battery is running low. I am connecting my laptop right now so we can finish this. Okay. And one more thing. Give me 2 seconds, please. Okay. Okay, here we go. Very good. Okay. So, nursing assessment also includes monitoring for a change in neurologic status that could indicate encephalopathy from a non-functioning liver. Report signs of clotting problems, like bloody oozing from a catheter, petechiae, ecchymosis, to the surgeon immediately, because this may indicate impaired function of the transplanted liver. Look at this table. Assessment and prevention of common postoperative complications associated with liver transplantation. And acute graft rejection, of course. Look at this.